One woman's debilitating pain simply vanished, but only after she realized what was really causing it and got the treatment she needed. Good morning. It is Friday, February 24th. I'm Jessica Lovell, and welcome to the Morning Medical Update. The woman you are about to meet had to give up her hobbies and pop painkillers just to make it through the day. And she loved to dance. But Alexis Del Cid shows us simply walking became too painful.
Julie French barely has words from when she was at her lowest point.
I literally felt like I was dying from the inside out. I could not walk even half a block.
But today, the Topeka woman happily chats about life now and how far she's come.
I feel like I'm 20 years younger now. I mean, I can move like I'm 20 years younger now.
For years, Julie says she lived with a terrible pain in the lower half of her body that kept getting worse. She thought it was because of an old back injury. It would turn out to be something far more sinister.
It was because the bottom half of my body was not getting a blood supply.
A trip to the doctor in Topeka revealed Julie had severe atrial plaque choking off the blood supply to her legs. That doctor referred her to the University of Kansas Health System vascular surgeon, Dr. Kara Hessel.
She's an excellent surgeon.
Because the plaque was so severe, the only solution was surgery, and it would be a big one. Dr. Hessel would perform an aorta bifemoral bypass, entirely replacing Julie's aorta all the way down to her groin. As dramatic as that sounds, and the surgery is, Julie says 3 weeks later, she was off all of her pain medication she'd been on for more than a decade, had joined a gym, and had not only ditched her walker, but was back on the treadmill.
The first time I went back to her office after the surgery, she was like, wow, you don't look like the same person that came into my office before. And I told her, I am not the same person that came into your office before. You have completely changed my life.
And we are pleased to welcome Julie to the program this morning. Good morning. How are you?
Good morning. I'm great.
Good. Love to hear that you're great. Here with me in the Dulcie Simons Jr. Family Broadcast Studio is Julie's surgeon, Dr. Kara Hessel, vascular surgeon here at the health system. How are you?
I'm well.
Good to see you. Julie, first just take us back before the surgery. You were living in pain every single day. You thought it was due to an old back injury, as you mentioned, right? Tell us more about that.
Yes. I had some cracked vertebrae and bulging discs on my back, and I thought that's what all the pain was coming from. And it continued getting worse and worse, and I was doing everything that I possibly could to make it better. They tried cortisone injections and a few other things, and it just wasn't seeming to help.
Yeah, it would be easy to make that leap. You have a back injury, that must be why you have the pain. So how did the pain, though, impact your day-to-day life? You're working, you're trying to spend time with family. What was that like trying to navigate through all that?
It was very painful. Every day I was in pain, no matter what I was doing. I do a lot of walking for my job, and I don't even know how I was managing to continue working full-time. But I was, and I could not do like a lot of things that I like to do. I love to go hiking, and I couldn't do that. I had given that up several years before, and couldn't go dancing anymore. Couldn't do a lot of things that I like to do, and it has completely changed.
Well, yeah, they say you never really know how much pain you're in until you start feeling well again, and you wonder how in the world you managed. How long did that all go on? How long did that pain go on? How long were you living this way?
About 15 years, I think. I just continued getting worse and worse. I mean, it just takes it away a little at a time, and you kind of don't notice it, I guess, or just assume it's because you're getting older.
And you were taking medication, pain medication to alleviate this. How long was that going on?
Yes.
And how much?
Too much. I was taking 4 Tylenol and 2 tramadol, and that would get me through about half of my shift if I worked an 8-hour shift. And so I think I've taken Tylenol once or twice since the surgery. So
your doctor
huge
Julie
difference.
in Topeka, yeah, huge difference. just getting off of that medication is huge. That's going to change your life in general. But your doctor in Topeka realized that this was a blood flow issue, not a back problem. And then they referred you to Dr. Hessel. So, Dr. Hessel, what do you remember about Julie when you first met her? What was that like, and how did you assess her?
So meeting Julie for the first time, Julie was using a walker when she came into my office. She was very debilitated. She was having a really hard time just making it through her day. And it was very difficult for her. And it was very apparent that it was very difficult for her. And we knew based on her imaging that she would likely need surgery. And she and I had a very frank discussion about it. And we decided to go ahead with surgery. And here we are.
And what was that conversation? When, she's looking for answers, she comes to you, you're looking at her thinking, we've got to get this woman better. I've got something ahead of me, this task ahead of me. What did you tell her was going to have to happen?
So she had quit smoking. Or she was about to, and we talked about that. That was one of the biggest components of surgery because of the fact that smoking can actually decrease it can affect complications after surgery, and it can also decrease the longevity of any surgery that we do. And so she had quit smoking, and we were going to move forward with that. And then we talked about the risks of the procedure and the recovery time in the hospital and everything, which was extensive, but something that she felt was worth it, and I felt was worth it. And so we decided to proceed.
After 15 years of pain.
Exactly.
I'm so glad you kind of took that leap of faith with Dr. Hessel. So, Julie, what was your experience when you first met Dr. Hessel, and what was that like for you to know you finally found the person who might have some answers?
I had brought my sister with me to that appointment that day. Well, she had drove me to that appointment that day. And we were both very impressed by the fact that Dr. Hessel didn't seem to be in a hurry. I mean, she wasn't just rushing from patient to patient. She took the time to sit down with us, explain everything, answer all the questions we came up with. And that was very impressive. I mean, I liked that. She had a couple of other of her staff in the room at the time, too. And they just really took their time and made me feel real comfortable. I had already researched her, and she seemed like extremely capable, the surgeon, and she definitely was. She's my new hero. So I was, I knew it was a kind of a risky surgery, and I was okay with going, I felt comfortable going through the surgery and everything. I knew I would, survive the surgery. I felt comfortable about that, but I honestly did say yes when I woke up, so, but, the pain afterwards, it was not near as bad as what I thought it was going to be. I'd had a surgery before, and, the recovery of a surgery is pretty extensive and pretty painful, but it wasn't as bad as I thought it would be. So,
Dr. Hessel,
I really wanted to get better.
Well, and you are, and I, we're having kind of a hero moment, but you do this every day, and to know that you're someone's new hero, how's that feel?
It feels pretty good. We always like seeing our patients have really good outcomes, and we're so happy for Julie that this is the outcome that she's had.
So, Dr. Hessel, so blood wasn't reaching Julie's legs. I want to talk about where her blockage was. Tell me a little bit about that.
So Julie had a blockage in her aorta. The aorta is the main blood vessel that comes down from the heart, and it travels through the abdomen and then splits in two and goes down into the legs. The blockage was actually basically from where her kidney arteries are going to come off, and we have some imaging of that here. So this is actually Julie's CT scan from her preoperative appointment. So that white stuff that's in the center, this is her spine, and then right above that there should be white that actually comes all the way down, and you can see gray instead that's outlined by a white ring. So that's where Julie's aorta should be. And these other two circles of white, that's her iliac arteries. That's where those should be. That's where the arteries split and go down into the legs. And then you can see that the brighter white kind of comes back in down in her thighs. So that entire area of blockage is the segment that we needed to replace of her aorta, and we actually did a surgery. We made an incision on her abdomen and cleared things out, and then we actually go in and replace that segment of the aorta with a graft, and that allows the blood to flow around the area of blockage and actually get down to her legs and keep her from having that terrible pain when she walks. It's one of the main symptoms that we see in this is where people will have significant pain when when they're up and walking that is then relieved after they stop walking, and it usually occurs after a certain distance and is relieved after a certain period of time. Oftentimes they may also have pain in their legs that occurs when they're at rest, and that is one of the significant things that push us towards doing surgery if they're having very short walking distance, or they're having that pain at rest, or if they develop wounds in their legs. And it's all due to that arterial plaque that's limiting the blood flow to their feet.
So Julie, you mentioned that it wasn't painful when you woke up. So how soon did you know that the pain that you'd been feeling for 15 years was finally gone?
Pretty soon afterwards, when they got me up walking, then, there was pain from the surgery, but it wasn't the same pain, like I had before. And so, when I was in the hospital still in intensive care, I could tell there was a difference. So, because before I could not even lay in bed for very long without I would have pain, even it would wake me up because I could not stay in one position for very long.
Yeah, just having pain laying there, it tells you, that kind of tells the story, not just pain walking around. But what would have happened if she didn't get this fixed? What would have been the long term if this just would have gone on and on?
So the pain would have been significant for probably the remainder of Julie's life. And it is also possible that she would have developed wounds on her legs because of the restrictions in her blood supply. We have to work really hard to protect people's feet when they have significant blood flow issues, because if they have any injury to their feet, then it can develop into a wound, and that wound can get infected, and we can be looking at limb loss.
So amputation possibly. What about organ failure? We talk about just not the proper blood supply getting to the right places in the body. Could it cause damage to other vital organs?
So in Julie's case, we've talked a lot about her legs, but the blockage was actually also sitting right at the area where her kidney arteries are coming off. And so we actually had to do a portion of the surgery that restored some of the blood flow to her kidneys as well. So her kidneys overall could have shut down over time because of the fact that she had that blockage there. It could have caused blood pressure issues. It could have caused decreased ability to make urine, and could have ultimately resulted in renal failure and needing to go on to dialysis. So that in and of itself was a reason to do the surgery.
I want to talk about smoking, because anytime somebody... Oh, go ahead, Julie.
Kidney. I did lose one kidney before the surgery.
So tell us about that. And that was due to this problem?
It was due to the blockage, yeah. So the amount of plaque that she had there, her I believe it was your right kidney, Julie, that had extensive amount of plaque there, and that had actually kind of choked off the blood supply to the right kidney even before we met. The left kidney had an extensive amount of plaquing as well, and so we were able to remove that plaque and improve the blood supply to the left kidney so that it could do the work of both of her kidneys then.
Let's talk about the smoking. Did that have what kind of factor do you think that may have had? We always know when somebody quits smoking, that is a good thing. Could it have led to this issue?
So smoking is a factor that plays into the development of plaque development, but it's not the only thing that goes into it. So people have genetic predispositions for plaquing, so we know that atherosclerotic disease runs in families. We see it in coronary artery disease as well as throughout the body. And then high blood pressure, high cholesterol, diabetes, kidney disease, all of those things play into this. Smoking is only one component, and so we want to make it clear to people that this is not your fault. Smoking is something that happens, and there are a lot of people who struggle with the addiction of smoking, and we are here to support people in their fight to quit, and not here to condemn them for it. And we are going to make every effort to make sure that we are supporting you through the process of quitting and getting you to the point where you can get back to your daily life.
Yeah, and we just had this show a couple weeks ago where they come to the bedside. That's a whole other issue, and it's there to say not just you got to quit smoking or else. It's you got to quit smoking, and here's how we're going to help you get through it now and for the long term. So a huge congratulations, Julie, for that. That is huge, and we know that. So good for you. I want to ask you about your family history, Julie. What has that been? Any history of cholesterol issues in your family?
Oh yes. Everybody almost in my family has trouble with high cholesterol, and unfortunately I have an anaphylactic reaction to any cholesterol lowering medication that's on the market today. They do have a new one that they're wanting me to try that's an injectable, but I couldn't take any cholesterol lowering medication, and diet does not seem to affect it a whole lot. No matter how well I eat, then I still seem to have high cholesterol.
So, Julie, let's talk about where you are now. You said you had to give up dancing. Are you back at it?
Yes, I'm back at. I'm able to hike. I can walk. I can easily walk more than 2 miles on a treadmill with no problem. You know, and it's just the little things that people don't notice. Like one of the first things I did after I came home from the hospital, one day I went out and took the trash out to the end of the driveway. And before I could take one trash can and then I would have to sit down. And then I could take another one and then I would have to sit down. But I went and took all 3 trash cans out to the end of the driveway. And I came back inside and I told my mother, guess what I just did? And she said, what? And I said, I just took the trash out. And I didn't have to sit down and rest in between. I just took all 3 cans out. So I made 3 trips out to the end of the driveway and back. And that sounds like such a stupid thing, but it's every day I do something that I realized I could not do before the surgery.
It's those little things, those little milestones, taking out the trash. We like to hear those things. What else are you looking forward to? Spending a lot of time with family, I would imagine.
Yes, and I am very much looking forward to being able to go out to California and go hiking with my son in Olympia National Forest and the Redwood National Forest. We wanted to do that since he was a kid, and he lives out there now, so I'm looking forward to that. That's going to be great. I'm working on getting my muscles built back up so I can hike as long as he does, because he goes like 7 or 8 miles at a time. So
good for you. I couldn't do that.
That'd be great.
Dr. Hessel, what's it like? What's it like to see Julie now versus when you saw her when she came in that wheelchair?
I'm just so happy for her. I'm so happy for you, Julie. This is an amazing outcome, and we're very, very happy to see her have this. For me, it's incredibly rewarding to be able to see a patient who has gone from being completely incapacitated by daily pain to being able to do all of the things that she wants to do. It's an incredible, incredible thing.
All right, let's get our questions sent in. If you have questions for Julie, yeah, go ahead. Julie, did you have something to say?
No, I just said that it's awesome being like where
It
I'm
is
at
awesome.
now. It's amazing.
It is. We're excited for you. Again, from taking out the trash to hiking, it all matters. If you have questions for Julie or Dr. Hessel, get those sent into Facebook, YouTube, or the Medical News Network. You can find links to those there on your screen. But let's get a quick check on our COVID count with Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control. Happy Friday. How are you?
I'm glad it's Friday.
Yeah, right.
I'm good. Right now in the hospital, we have 48 total infections. Of those, 26 are active, still 4 in the ICU and 3 on the ventilator. So numbers just holding steady, unfortunately.
All right, Doc Hawk, I know you've been waiting for this next headline to come out, but the CDC officially says the flu shot provided substantial protection this flu season. We know the effectiveness can vary from year to year. And this year it's been more effective than usual. Doc Hawk, how good was this year's vaccine, and what made it so good?
You know, I think it was good. Yeah, of course, we know and understand that you have to anticipate what the circulating influenza strains are and then put those into the vaccine. And in the vaccine, they put 4 different strains. They put 2 A strains and they put 2 B strains. So right now what we have is this interim analysis, and we'll know more later in the spring or early summer about the full analysis. But what this interim analysis showed was that it was extremely, I would say extremely effective for an influenza vaccine. It was actually 54% effective at preventing somebody who is 65 and under from having to go and seek medical treatment, which is a really good win. Even more than that, it was a 70% effective at preventing symptomatic illness in those people under 18. So we have an effect against symptomatic illness, which is good, and hopefully that keeps children well, but also more importantly is it has a significant effect in keeping adults from having to go seek medical therapy as well.
Let's see if we have any reporters on the line. Let's get to our community questions from our viewers. Becca wants to know, Julie, did you feel any other symptoms besides just that chronic pain?
I had high blood pressure, but a lot of people my age do. But no, really, other than the pain. I did have some pain when the kidney was being choked off and dying, but that was about it.
A question from Kim is, what was the recovery time like? Well, I'll ask you, what is it normally? And then that you could tell Julie what yours was, but what would it normally be, Doc?
Yeah, so after surgery, we usually keep people in the ICU for 1 to 2 days as a planned ICU admission. It's a big surgery. It can be tough on the heart and the lungs. And so we watch people very closely in the ICU to make sure that they have a good recovery for 1 to 2 days. And then we usually see an inpatient hospital stay of 5 to 7 days. Depending on people's level of function prior to going to surgery, they may require a short stay in rehab or in like a skilled nursing facility, just until they can recover enough function to be able to go home. Stairs are a hard challenge after you've done like a big belly surgery, and so sometimes going back to a home environment is not quite safe just yet, and so going to rehab is sometimes a good option and a good step in between.
Julie, what was it for you?
I got out of ICU a day sooner than they thought I would. And every time they got me up to walk in the hospital, I would go twice as far as they asked me to. But I was out of the hospital after 4 days. I think I was released from the hospital. And at home, it just continued to go pretty fast.
Tom wants to know how long the surgery takes.
So it kind of depends on the extent of the disease. In Julie's case, where we were also doing this artery to the kidney, it took a little bit longer, but usually on the order of 2 to 3 hours for just a standard aorta bifemoral bypass. And that also kind of depends on the extent of the plaque that's in the groins as well. Sometimes we have to clean out those arteries too. And so that can be a little bit longer. And so the procedure can last anywhere from like 2 to 5 hours typically.
Lynn wants to know, was Julie's bypass artery harvested from somewhere else in her body?
Not in this case, no. So that is something that we can do sometimes, especially if anybody has signs of infection in their belly. We will sometimes take vein from a different location and move it to the belly. And so if that is the case, then sometimes we do. But in Julie's case, we actually used a synthetic material. It's actually the same stuff that raincoats are made out of. And so it allows us to replace that aorta and have things go through in a waterproof fashion.
All right, that's a fun fact.
Yeah.
Fun Fact Friday. Pam wants to know, Julie, are you going to get another kidney, or are you just going on one kidney right now?
My kidney is functioning very well, so I don't have any. My renal function is doing great, so I don't believe I'm going to ever need one.
Yeah, in Julie's case, we were able to get things taken care of before the renal function was compromised on the left side. And so we were able to make sure that she didn't need to go on dialysis, which is incredible for her.
So either dialysis or a possible kidney transplant?
Yeah, a lot of people end up on dialysis even for a brief stint, regardless of whether or not they get a kidney transplant. And so it would have potentially meant dialysis for her. Yeah.
And that is scary. Let's get to final thoughts from our... go ahead, Julie, please.
I knew dialysis was a possibility and that I would probably have to have it while in the hospital and after coming home. And when I didn't, I was like really happy about that.
I bet. Yeah. So I guess, so it was either dialysis or the surgery, correct?
She wasn't quite to the point where she would have required dialysis then, but it was definitely a possibility in the future.
In the future.
Yeah.
Okay. So let's get to final thoughts. And Julie, I'm going to start with you. Just what do you want our viewers to know today? If
you get the option of having the surgery, do it. It is huge. It's changed my life.
Well, there you have it. Dr. Hessel, final thoughts from you. Just message to folks listening, and what do you want us to know?
So here at KU, we are developing an aortic center, and we have the Center for Advanced Vascular Care. We are committed to our patients, and we are committed to ensuring that they have good outcomes and that they get back to their life. And that is the thing that we want most for people. And I'm just so happy for Julie that she's been able to do that.
Yeah, we love it when you two can see each other and see each other in a better way. And will she have some follow-up with you or other folks? How long will that go on?
Julie and I are lifelong friends.
Well, yeah, exactly. I love that. I think you're okay with that, Julie.
Yes, I am.
All right. And just I want to, just before I let you go, we're talking about, you're talking about our center, and just how do you know, when should people know to come see you? And just to really take these things seriously, and to be advocates for their own health, their own heart health.
Yeah, so we rely pretty heavily on primary care physicians for referrals and to identify vascular disease in general. And so, just making sure you see your primary care physician for your yearly physical, and that you're talking with them and letting them know the issues that you're having, and making sure that they're aware of any symptoms that are going on. And then a lot of the time they are very astute in identifying that, and they'll make those referrals, and you'll get to the right place. You just have to be open with them and let them know what's happening.
Well, like in Julie's case, she did her own research. She had researched you before she even met you, so she was excited. So be your own advocate and ask lots of questions. Dr. Hawkinson, final thoughts on this Friday?
Yeah, hi. Again, another great story. Great teams here getting appropriate, adequate evaluation and then management. I think certainly University of Kansas Health System offers that with our medical teams and collaborations. Also, very happy to hear about the interim analysis of the influenza. We did see an early spike in influenza cases. There is always that chance for that second wave. You still probably have about another month. If you have not been vaccinated, please go get vaccinated and help protect yourself and those around you.
Great message. Everyone, thank you so much. Thanks to our guests, and thanks to our viewers for being with us today. Have a great weekend. We'll see you back here Monday at 8. Coming up Monday on the Morning Medical Update, diet and exercise help manage diabetes, but not all diets are created equal. I'm Jessica Lovell on the next Morning Medical Update. The new research on intermittent fasting focused on not just what you eat, but when you eat. The impact on blood sugar, Monday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.